Hello everyone and welcome to this lunchtime webinar. My name is Jenny Soreskog-Turp and I'm the lead for Postgraduate Education at the RCVS. I'm joined today by two veterinary surgeons. Live with me today is Sue Paterson, who's our Chair of Education Committee on RCVS Council. And we also have a pre-recording from Richard Stevenson. So this week we have been doing two webinars about CPD. On Tuesday we were covering reflection, and today it's more about what counts as CPD. So we'll be talking about the RCVS CPD policy, what type of activities you can count as CPD, but really focusing on the flexibility of the policy, and we'll give you an overview of it, but really focus on your questions today. We have received several questions as part of the registration process, but you're also able to ask questions as we go along. So just pop them in the chat box and then my colleague Joe will collate all the questions and ask them in our live Q&A session at the end. So today is all about making sure that you get what you need out of this webinar. So do ask as many questions as you want, as there are no stupid questions. We do get a lot of questions about what counts as CPD into our emails and on phones. A lot about, can I count this activity as CPD? How many hours does this count for? Do I have to do clinical CPD? And how do I evidence or record my CPD? So I'm hoping that after this webinar, you'll have a clearer idea of how the CPD policy works and realize the flexibility of it. So to start off, we'll hear from Richard Stevenson and talk about his approach to CPD.
Hi there, I'm Richard Stevenson. I qualified way back in 1987. It seems a tremendous long time ago now. And I was just reflecting the other day that a lot of the jobs I do in practice weren't even invented when I graduated, or at least were very, very difficult in equine practice. When I think of things like ultrasound examination, you had to have a machine the size of this room, and you got a tiny little grainy picture which looked more like a snowstorm to me. And I can remember actually referring horses to Newmarket practices just to have a tendon scan. MRI, something we do every day, was simply not available for horses. And when we think about gastroscopy, we didn't even know horses could get gastric ulcers. I remember actually being taught at college that when ulcers were found in stomachs post-mortem, they were post-mortem changes and they weren't clinically significant. We now know, of course, one of the most major diseases. So how do we keep up to date? How do we acquire this knowledge as we go along in practice? And one of the commonest questions that the college gets is, what is CPD? And we all think of CPD as going to conferences and congresses, and of course that is a great way of doing CPD, but it's not necessarily the right thing for you today. And of course it's been extremely difficult for the last year due to COVID-19, when we've all actually had to expand our horizons as to how to do CPD. So we're now all very familiar with the webinar. I'm sure we can all do online journal clubs, but it doesn't have to even be that formal. In our practice, we often have very animated discussions about case management. We try to have a clinical meeting once a week we do have a clinical meeting once a week when we discuss any difficult cases that have transpired during the week. If we haven't had any difficult cases, which is rare, we might do a journal club, and we do have a cycle of talks on various seasonal issues that we do tend to repeat every year just to reinforce the knowledge in case we've forgotten about foals, for example, since last year. And you know, even just reading a journal can be very, very valuable CPD. But what we do need to do is we have to record it. And one thing I've become a great fan of is the the app, which I'm sure you've all got on your, you can't really see it actually there. But one thing I've discovered about this One CPD app, and I've only discovered this last week myself, is on the Reflect bit, which is something I've always been a bit skeptical about, but on the Reflect thing, that you can actually, if you go into Reflect and you do the free bit there, you can actually dictate into the app. So if you're like me and you can only type with one finger and you hate all this having to record everything, you can actually just talk to the One CPD app and do your reflecting. And I've only discovered that about a week ago, and it's absolutely fantastic, and it's made a big change. So remember, anything can be CPD, anything related to your work. One thing, bizarre one that I was asked about years ago was somebody doing reversing a trailer course. Could that be CPD? It turned out that they actually were providing a equine ambulance service, so reversing a trailer is actually quite important, useful CPD for them to do. It just has to be recorded, and I think with the app, with the ability actually just to talk to it, we can all really actually enjoy recording our CPD rather than it being a chore. So best of luck with your CPD. I hope that's helped you and given you a few ideas, and I hope you enjoyed the rest of the webinar.
So thank you, Richard. Yes, so as Richard was talking about, CPD is all about lifelong learning, and working in the veterinary profession, there's always going to be new drugs, new techniques, and even if you're not working in clinical practice, there's going to be new legislation and new evidence that you need to stay on top of and develop yourself, but also to make sure that you have a fulfilling and interesting career. So as I'm sure you're aware, CPD is mandatory as part of our code of conduct. It's 35 hours for veterinary surgeons and 15 hours for veterinary nurses. And from next year, we are changing the approach to CPD slightly. So we're focusing on outcomes by using the outcomes-based cycle of plan, do, record, and reflect. But what counts as CPD has not changed. And the RCVS has a really flexible policy, so any learning or development that's relevant to you as a professional person can count as CPD. You're all professionals, you know how to meet your learning needs and development needs. So the RCVS does not tell you what type of CPD you need to do, what format of CPD you need to do. But as long as you stay on the register, whether you're a veterinary surgeon or a veterinary nurse, you need to comply with the full requirement. So it doesn't matter if you're working full-time, part-time, if you're retired and only go and see a few cases, or if you're not working in clinical practice, the requirement is the same for everyone who's on the register. There are a few exceptions, so veterinary surgeons, they can change to non-practicing, and you can do that anytime during the year. Just go into your My account and change that status. And then when you're ready to go back into work, you can change it back, so it's a quick process. Veterinary nurses can remove their name temporarily from the register. And again, you can do that in My account, and if you restore within 18 months, you don't have to pay a restoration fee. And if you need to stay on the register, but you're struggling with your CPD, you can apply to pause your CPD. So that might be for illness, taking care of family members, or parental leave, for example. And you do that by going into your One CPD account on the web version, not the app. So our CPD requirements, it's all about what you need and what's relevant to you. So if you're not working in clinical practice, your CPD doesn't have to be clinical. And the type of CPD that you undertake, it doesn't have to be courses that you do outside of work. You might be doing CPD as part of your role without realizing it. And it's just making sure that you record those session, and then you can count this towards your CPD requirement. And when you plan your CPD, I think it's really useful just to step back and think about what do I actually want to do, or what do I need to do? Were there any significant events in the last year that you want to take advantage of and have as part of your CPD plan? Think about any opportunities in practice. But when you plan your CPD, try not just to think of courses and webinars. Also think of, can you learn from someone in practice, any team meetings or anything like that. And objectives and plans doesn't have to be something we do in January and then it lasts for 12 months. It should be a really dynamic process. You can do it at any time. And we have our one CPD, which is our recording portal, and using the app, it's easy to put an objective in. So it could be a really short-term objective. For example, you're working in practice and a pet comes in with diabetes and you're able to treat it fine, but you just realize that you need to brush up on your skills a little bit. So you could just take out your app and just add an objective there. It'll take less than a minute, and then you'll have it saved in your e-portfolio to remind you later, and then you can link activities to that, because we're all busy. It's so easy to forget as we go along. But of course, CPD that is not part of your plan still counts. There's going to be many opportunities that you get that's not part of your plan. But you might reflect on them and think, actually, I want to learn more in that area. So it might become then part of your ongoing CPD later on. And we always get questions about what is objectives, how much information do I have to put in. So we've added a few examples here. You see a few clinical and non-clinical. And it depends on your role. Again, you don't have to have the clinicals if you're not in clinical practice or non-clinical. But you can see they're quite generic. You don't have to put a lot of details into them. I think one of the most common questions we get is for people who's no longer working in clinical practice, and they're asking if they need to do a specific number of hours CPD that's related to clinical practice, and no, as long as your role is not clinical, then you don't have to do CPD that's related in that area. And even if you are working in clinical practice, your CPD doesn't have to be all clinical. It's about looking at you as a professional more holistically and think of anything that's relevant to you as a professional. And of course, CPD is going to change as you progress in your role and as your personal circumstances change. Having young children, for example, you might not be able to do the evening courses or seminars, so you focus more on work-related CPD or reading. And you might not like distance learning, so reading or face-to-face CPD once we're able to do that again might be more appropriate for you. And in our recording portal, One CPD, we have a few subcategories to record your CPD, just to try to encourage a wider range of activity. And I think the ones that is used less is workplace-based CPD. So think of any learning and development that helps you to do your job more effectively. You might have case discussions with colleagues, team meetings, or think of everything that's changed over the last year because of COVID. You will have done so many changes and learned so much, and that's probably going to be one of the most relevant CPD you did last year. So that might be part of your objectives, and you can have that as part of your plan to learn at work. But I think many of the workplace-based CPD is also going to be more ad hoc and spontaneous. And then the other two categories is formal, which is probably the more typical CPD. We think of courses, seminars, distance learning and webinars, but we also have self-directed learning, which is reading, preparing papers, preparing presentations. And we always get questions about how do you evidence that you've done self-directed learning? And we trust you, so as long as you record it is fine, but the best way to evidence your CPD is to reflect on it. So again, using the recorder portal, One CPD, you can just record your time that you spent reading or preparing a presentation. That's your CPD, and then go to the reflect section and add your reflections and add your learning and your impact, and that is the best way to provide evidence for your CPD. So that's all from me at the moment. I'll show you quickly how to use One CPD at the end, but I'll pass you over to Sue Paterson, who'll talk about her approach to CPD.
Thank you, Jenny, and thank you everybody for joining us. I'm going to start with a little bit of an apology. We have a thunderstorm in Cumbria at the moment, so if I freeze, I apologise. I think probably Jenny will have to do a tap dance or something just to fill in the time. But what I thought I'd start by doing is, last night when I was looking through this and thinking how I was going to sort of present a little piece for you, I thought we'd start off just by looking at a definition of CPD, because I think that's a really useful starting point. And so what I found was, it says it's learning activities that professionals engage in to develop and enhance their ability. So that's really, really broad ranging. And I think what I would add to that on a personal basis, and we're talking about both vets and vet nurses, of course, when we're talking about veterinary professionals, is that it has to be directly or indirectly to improve animal health and welfare, because that's what we're all about. So what I thought I'd do is I just talk through those three big groups that Jenny's already referred to, the formal, the workplace and the self-directed CPD, and just give you some more examples of the way that I fit my CPD into those three categories, just to hopefully give you some just a little bit of a feel for how we can do it, and also just to perhaps direct you to some resources, because I sit on one of the CPD referral groups, and one of the things that we commonly see is people struggle to have resources to actually be able to go and do CPD, particularly that fits in around their lifestyle. So my first thought is really, I think it's important to mix and match. So use lots of different ways to do your CPD. And of course, we've got lots of different ways in which we can do that now. Richard referred to it before when in his pre-recorded presentation. We're all missing face-to-face conferences and courses, and although there's fabulous virtual stuff about, I think one of the things that we should say about face-to-face CPD is it's not just the formal lectures that are our CPD, it's all the bits in between times too. So I love, when I go to a dermatology conference, the opportunity to chat over coffee with friends or discuss scabby dogs over lunch. And the post-course discussion forums are really useful, and that is all CPD, because you're reflecting, you're discussing, you're exchanging ideas. We know the massive amount of virtual stuff that's been available to us over the last 12 months, and we've got webinars, we've got podcasts, there's been lots of Facebook events. There have been clinical and non-clinical CPD offerings. I mean, people like BVA, VDS have done some fantastic stuff around great places to work. College has done some great stuff around the campfire chats. And I have to say, I'm a convert to podcasts. Any of you who've not discovered Podbean yet, there's probably over 100 different providers on there providing veterinary CPD, and it's all free. And then the other thing, of course, that a lot of us are very, very aware of now is sustainability. And I've just enrolled for external qualifications. I've just registered to do an EMA Foundation course in sustainability. So it all counts as CPD, and that's formal. When we're looking at workplace CPD, we do this all the time at work. So face-to-face in the workplace, discussing cases. You know, it may be, how did you manage that diabetic dog? How did so-and-so respond to that new ear treatment that you'd use? So clinical rounds, face-to-face discussion with friends. But even virtual discussion groups are useful too. So things like Vet Voices, things like Vet Wings, things like the carpool cases, which BVA did, online discussion forums, so non-clinical stuff, for example, some of the stuff that SPIBs do. And I'm a member of a derm listserv where I can discuss cases with friends all over the world. So it all counts as CPD. Mentorship is important too, whether you mentor somebody, a colleague at work, whether it's a new vet, a younger vet, or whether you're actually mentored yourself. And I do both of these. I mentor and I'm also mentored. I have a clinical mentor, people who I go to, I chat with, who I can talk through cases with, but also I have someone who helps me around personal leadership, helps me to reflect and improve in the way that I approach things. For example, it may be something really simple, just like how to chair a meeting, to actually get the outcomes that you want from that meeting. And that's all workplace-based CPD. Self-directed stuff, I think this is where people sometimes struggle, but lecturing, of course, Jenny's already mentioned it, and preparations of lectures. And it doesn't have to be if you're a specialist presenting a lecture. It could be you're presenting to a group of local scouts. It could be you're going to the Women's Institute. It could be you're just doing something in a practice environment. It's the ability to look, to research, to check there's nothing new in the literature. That's really, really important. And certainly before I present something, I'll always go and do a PubMed search. I'll go into the college library and just see if there's anything that I need to include, or I may even just revise something. You know, I may just revise a pathway, for example, just so that I know that I'm able to explain it in simple terms. Writing papers, obviously, literature searches around that. But then more simplistically, just in a practice situation, you have a difficult case. You know, it may be you phone a friend to ask advice. It may be you go onto a telemedicine platform to ask someone. It may be you read an article the night before you've got that difficult case coming in. You may want to check treatment options. You may, if you've got surgery coming up, you may want to sit down and revise the anatomy of a certain approach to a particular case. And then, of course, things like veterinary reading, and veterinary reading is, again, very broad in its context. And that might be something like reading around welfare, looking at the new animal welfare legislation, BVA's work, for example, on ear cropping, or it may be, as I've done recently, reading through a new consensus paper on feline allergy. So there are lots and lots of ways of doing your CPD. It's really flexible. It's entirely up to you how you do it. And it should be enjoyable too. I really enjoy some of the CPD that I do, so I think it's important that we all do. So that's enough from me. I'll hand you back to Jenny. Jenny's going to just talk us through One CPD and how that works, the gorgeous Royal College app, which even dinosaurs like me and Richard's already says he can use as well. And then I think we're going to take some questions. So back to you, Jenny.
Great. Thank you so much. So I'll try to share my screen again. So hopefully that's my phone. And so we've been mentioning One CPD quite a lot today. So that's our recording portal. It's available both as an app as a website. And we did some webinars in December last year for new users and more experienced users. So I'm just going to show you quickly how to use the plan and record session, but you can refer back to those webinars just to get a more in-depth demonstration. So in the planning section, you're able to add objective, you can edit your objectives. So as I said before, an objective doesn't have to be something you do for the next year. It could just be that you want to review evidence for diabetes. And as Richard said, using your phone, you can just dictate into it rather than typing if you want to. So I'll just, on my phone, it's next to the space button, and I'll just press the microphone. Review evidence for diabetes. And then I'll just do that. And you could put a description, but sometimes it's I think it's enough with the title. And a due date, again, is not, you don't have to put it there, but I'll give myself a week, confirm, and then save. So then it's saved here as part of my objectives, and you can see I don't have any time recorded against it yet. So now you've added the objective or plan, and it takes you less than a minute. So it is something that's really quick to do. And then to record it, it's just the basic information, the topic, the duration, the date. You can put a start date or an end date if you want to. And then the activity types, this is what both me and Sue have been talking about, the formal, the workplace-based, and the self-directed. So there's a list of activities under each subcategory, but we also have other. But don't worry too much about the categories. You can always add some information in the note section, and you don't stress about making sure that you always get the right category. That's not the most important thing. And then you're able to link it to an objective. So that's how you'll record the time in the objective side. So you could just link it to anything, or you can also press the plus sign, there, and you can create an objective here, which will then be saved in your plan section. You can add notes, and you're also able to add a attachment. So for example, a photo, a voice note, or anything like that. So if you have a certificate, you can take a photo of that. You might have some notes, or you want to take a photo of slides, for example. If you're going to a presentation, you can use one CPD as your learning journal, not just an app for recording your hours. So, but again, if you want some more information, go to our One CPD webinar. But I think hopefully we have some questions that we can from Joe.
Yes, we've had a really high amount of questions, so please bear with me with the chat box. So many of these questions came in as part of people's registration. So Jenny, the first group of questions are for you. So does this workshop count as CPD?
Yes, it can count as your CPD. Just remember to record and reflect on it.
Do team meetings count as CPD?
Yeah, I think that's an excellent form of CPD. And again, using the app, you can record some of the reflective discussions that you have as part of your team meeting. So yeah, a great form of CPD.
As a PhD student, a lot of my learning has been lab techniques or bioinformatics. Can that be counted as CPD?
Yes, of course. It sounds great. Again, just remember to keep a record of it.
Do courses and conference about animal nutrition count as CPD?
Yes, I feel like I'm just saying yes, so you can see that anything that's relevant to you does count as CPD. So it's just about thinking about what's relevant to your role and what you can benefit from.
Okay, a bit more specific, what counts as CPD for vets working in food safety and animal welfare? Again,
it will depend on your role, but I'm thinking there'll probably be a lot of legislative changes due to Brexit that keeping up to date will be a relevant CPD for you, for example.
Thank you. I've done a 35-hour course on pet bereavement. How much of this would be considered as CPD?
It sounds like really interesting CPD. So yeah, you can count 35 hours of that course as long as you feel it's benefit. Again, just record it and then to evidence that CPD, reflect on your CPD. So you don't have to have a certificate, as long as you reflect on it. That's the best evidence you can have.
Thank you. So it will be useful for you to clear something up. There's a question, why does reading veterinary journals no longer count as CPD?
So I think there's quite a common misconception that in 2016 we removed even the undocumented 10 hours for veterinary surgeons and 5 hours for veterinary nurses, but that didn't mean we removed CPD as reading as a CPD activity. Reading is an excellent form of CPD. You just need to evidence it. So we used to say you need to have document your reading, but now using the One CPD, you can just reflect on your reading or self-directed CPD, and that really is the best way for you to evidence your CPD.
Thank you. And the final question for Jenny before we go to Sue, is there a limit of how many webinars we can count as CPD?
No, we don't limit the type of CPD type of activities that you can do or that you should do. It's up to you to determine how best to meet your professional needs. I would probably recommend to try to do a wide range of activities, but again, it will depend on your circumstances.
Okay, so the next tranche of questions are for you, Sue.
Radio.
The first one is, how do I categorise producing clinical SOPs and protocols for my practice?
So, I mean, this is a question that came in advance, so I have to confess I had a sneak view of this, and I had a look through the CPD app. And I mean, my first comment would be, I don't think we need to get too hung up on how we categorise these things. The important thing is that we do the CPD and reflect on it. But I would probably put it under workplace, and I'd probably put it under other. And I think that will probably be enough. I don't think you're going to get taken to disciplinary committee by putting your CPD under the wrong category. So I think as long as it's close enough, that should be absolutely fine.
Thank you. So self-directed CPD, what counts and doesn't count? Is reading for cases CPD, even if it isn't formally organised? How many hours of my CPD can be self-directed?
Well, as Jenny's already said, college does not dictate to us how much of our CPD is self-directed and how we do it. It's all about personal development. So if we're looking at, cases for CPD, yes, absolutely, all of that can count. And it may be something like you've got a dog that's come in which has got severe arthritis and it's uncontrolled with its pain. So you go back, you look at pain relief, you speak to some colleagues. It may be you've got a guinea pig coming in the next day, heaven forbid, if it's me, for an anaesthetic. So the night before you go and have a look at the anaesthetic protocols. Again, you might speak to an exotic specialist. It may be you've got a dog with lymphoma, so you look at some protocols, you might read around it. It may be that you've got a dog that's had a side effect from a drug. And you go and you have a look in the data sheets as to what it is, what alternatives there are. So all of these, I think, are CPD and are things that you can reflect on and things you can record. But again, as we said before, I think it's good to have a real mix of CPD. So whilst I would be absolutely comfortable including that, I would suggest there's other stuff you might put in as well.
Thank you very much. Can you include online health and safety updates and things like pet plan training as CPD?
Yes, I think that's absolutely right. Yes, I mean, particularly during COVID, all of the stuff the fantastic webinars that were put out by BVA on Sundays about health and safety and risk assessments around COVID and safe working at work, all of that was CPD. And then things like pet plan training. Yes, again, I think it's really important to understand about insurance. We should be able to have informed decisions with clients around insurance, and so yeah, all of that is CPD, because it goes back to what we were saying before. They're learning activities that help us to develop and enhance our abilities as veterinary surgeons. So yes, that's all CPD. Great.
I'm not in practice. I teach in a university. How much of my teaching prep time and student supervision can count as CPD?
I think that's a more difficult one to categorise, because obviously the day job is something that involves those teaching. But what I would suggest, and certainly I think the way I would look at this, is that if it's stuff that you have to do around that core teaching, around that core supervision. So, for example, if you need to update your lectures, you're going to do a literature search, look on PubMed, look on College Library. So you're actually making sure that all the stuff is up to date. That would be CPD. If you need to look through notes, you need to do some revisions so you can supervise those students more effectively. So preparation for seminars, preparation for workshops outside of that normal activity. Again, I would suggest you could log that as CPD.
Thank you very much. What counts as CPD if I'm now in business rather than practice? And I've got another question that's very close to that. Do non-veterinary courses count as CPD? So we've had people asking about business and management, sign language. Somebody has an unusually large percentage of their clients with hearing problems, marketing, etc. Can that count as CPD?
Yep, absolutely. Again, as we've said, it enhances your ability to do your job. So whether it's communication, whether it's direct communication or sign language, fantastic. Whether it's risk assessment, whether it's financial training, whether it's health and safety, yeah, if it fits into your job, then it's CPD, absolutely.
I sit on various veterinary councils. Can our committee meetings count as CPD?
That's a more difficult one, but I don't see why it can't. Particularly if you're dealing with veterinary business. No, absolutely, I don't see why that shouldn't. Again, I wouldn't want that to be your only form of CPD, but you are exchanging ideas, you are chatting with colleagues. Perhaps it's indirectly benefiting animal health and welfare. But yes, I don't see why it shouldn't. But I would have that as part of a much wider, if you like, portfolio of your CPD.
Great. I think you've touched on this, but it would probably be good to revisit if we can. Is mentoring in the workplace CPD?
Yes, it is. And of course, the obvious example of that at the moment is Vet GDP, where we have literally thousands of people going through their online training in order to mentor new graduates. So yes, it very definitely is a form of CPD. But again, although that's hugely beneficial to the new grad, and it will be beneficial to you personally, I wouldn't want that as your only form of CPD. But yes, it is CPD.
Are Facebook Live events by APBC, CAM and other professions count? Do they count as CPD?
We keep saying yes, don't we? So yeah, it's another yes. I mean, as part of our much wider vet-led team, I think we've got a huge amount to learn from, if you like, some of the paraprofessionals that we work with, as well as vets who are in specialities. So working with behaviourists, working with people who know about pain management, wound management, I think is really, really important. So yes, the CPD, and I think these Facebook Live events, I've been to quite a lot of them during lockdown, are great because it's a great way to interact. It's a great way, as we keep saying it, to exchange ideas, to debate, to discuss, look at other people's ways of doing things, and looking at reflecting on the way that you do things yourself, and perhaps ways that you can change, you can improve, or perhaps help others to change and improve. So yeah, they're really important. Yeah.
I've got a couple of questions. I think I can ask them at the same time though. Does non-clinical CPD count, for example, mental health first aid training, and a lecturer is asking about keeping up to date with safeguarding issues for students? Do those count as CPD?
Yes, and actually I would say that's really important, CPD. And again, that's been reflected in a lot of the stuff that's been produced over the last 12 months, because we know that well-being and mental health is really, really important. So VDS, BVA have done a lot of stuff around their Great Place to Work. I mentioned it before, colleges, campfire chats. It's non-clinical CPD, but it's around well-being. And I think as professions, we need not just to look after our animals, we need to look after ourselves and our colleagues. So that's all part of a much wider remit of CPD, I would suggest.
Great. So this is the final question at this point, Sue, and then we'll go back to Jenny, please. It's more of a point, really, and I'm interested in your comment. I found it difficult to do CPD last year because of COVID and the changes we had to make in practice.
I mean, I think one of the reasons why college paused CPD for people, because we recognised that there were people in lots of different circumstances. There were people, for example, who were having to homeschool. There were people who were furloughed. There were people who were covering for other people who were ill, who were having to self-isolate. So everybody's circumstances were very, very different. I think the one thing I would say about the last 12 months is there's been a huge amount of CPD available, virtual CPD. I talked about podcasts, I talked about webinars before. So it's been available, but people's personal circumstances have sometimes not allowed them to do that. I mean, I've been in meetings where people have been having to have a meeting and talk in a sensible and educated way when they've got a 5-year-old running around in the background. So I think that has given us huge challenges around doing CPD. But I would hope, as we start to get some degree of normality, and particularly I hope as we flag some of the resources that are out there, and they're free resources and they're fantastic high quality resources, that people should be able to engage again and keep up to date with their CPD.
And possibly considering some of the work that they had to do in changing practice during the pandemic could potentially be counted.
Absolutely. I mean, I mentioned the BVA webinars before, but resources were put out by a lot of people, by SPIBS, by Beaver, by BSAVA, talking about safe working, talking about triaging cases, so having to prioritise what cases they saw, giving advice to people over the phone. Yeah, absolutely. All of that was perhaps us subconsciously doing CPD, even if we didn't have time to sit down and listen to a podcast. Yeah, absolutely, Joe, you're right. That was CPD.
Right, thank you very much. So coming back to Jenny now. I think you've covered this, but again, it would be good to revisit, I think. Does there need to be a range of resources used in CPD?
No, it's up to you. If you want to do 35 hours or 15 hours of reading, then that's fine. But I think for your benefit more than anything, I think it's good to try to use different formats of CPD.
Okay, the next question is very specific. I'm virtually retired and only treat animals with acupuncture one morning a week. How much CPD do I need to do, and does it need to be broad-based or just on acupuncture topics?
Yes, so as long as you stay on the register, you need to comply with the full requirement. It doesn't matter how much work you do or if it's paid work or not. So it's up to you. Probably focus on the area that you're involved in, but you might want to expand your horizons a bit and do other forms of CPD. We leave that judgment call up to you.
So I've got a couple of questions about online CPD now. So the first question is, I struggle with technology. I attended the BSAVA virtual congress, but couldn't access any certification. So does that mean I can't apply that for my CPD?
If you mean certificates, that is not, you don't have to add a certificate to your CPD. The best way to evidence your CPD is to reflect on it. So at least you're here now, so you're doing great with technology.
Thank you very much. And then are there any limits on how much online-based CPD can be submitted? No,
it's up to you. We don't dictate to you how to fulfill your requirement. You know best how to do that. You're a professional. You know how to fulfill your learning needs. Again, I think it can be good to try to mix it up a little bit, and especially hopefully as we can go back to more normality, to change between self-directed and face-to-face CPD. But again, it will depend on you and your circumstances and where you're at in your career.
Thank you. Will we need to record the planning of CPD from next year as well as the reflection?
Yes, it's part of the cycle just to plan, do, record and reflect. But as I've showed you in one CPD, you can add objectives really easily, and you can also record future CPD activities using the record function. But not everything has to be planned. So I think that's important to emphasize.
We've got a few more questions for Jenny, then back to Sue. So reading and pondering is the best way of learning for me. Listening and online CPD is not good. Can I log more reading?
Yeah, yes, I feel like I'm just saying yes, but yes, you can do it, and whatever works for you is fine. Just remember to record it and reflect on it so that CPD is properly evidenced.
Okay, the next question is the 25% reduction to the CPD hourly requirement being applied this year?
No, so we reduced the CPD requirements by 25% last year. This year it's gone back to the normal hours, but we do have the flexibility of the CPD requirement, so you're able to pause your CPDs. So we're trying to use that as generously as we can. So if you're struggling with your CPD, you're able to retrospectively pause your CPD or get in contact with us, and we can help you to sort this out. I think one of the best advice I can give you is, if you're struggling with your CPD, to get in touch. I think many wait until they're non-compliant a few years down, and then they call us almost in tears, and what I hear quite a lot is, I wish I got in touch a bit sooner, because it's been a great relief just to talk to someone about my CPD and given some great ideas of what I can do for CPD and some advice. So please do get in touch if you're struggling.
Thank you. And one more question for Jenny. I prepare presentations and upload the final version as evidence. Is this appropriate? I'm assuming as CPD.
Yes, sounds great. You can add it as evidence, but you can just add your reflections as well. So I think reflections and just thinking about your learning and the impact is the best way to evidence your CPD.
Thank you. And then, sorry, one more question for Jenny. Are notes taken during an event, like a virtual webinar like this one, do they count as reflection?
Yeah. Well, depends on what your notes were, but yes, they can be, yeah.
Okay, thank you very much, Jenny. Then back to Sue.
Okay.
Thank you very much. So I'm a university lecturer. Is there a formula, in inverted comments, I can use for CPD relating to lecture prep, such as X hours per contact hour?
This is one of the questions where I'm going to say no. If there is, I'm not aware of it. It has to be common sense, because I don't actually think that there is. I don't think it's possible to apply a formula, because of the amount of time certainly I would spend preparing some stuff is very different to the amount of time I'd spent for others. So no, it's not. It's common sense. But if you're a lecturer and you're keeping up to date, then you're going to far exceed your requirement for college, because the amount of reading that you have to do to keep up to date, the amount of research that you have to do. No, there isn't a formula that I'm aware of, unless Jenny's aware of something like that. I don't think there is anything, is there?
No, just count the time where learning takes place, but no magic formula, I'm afraid.
No, not at all.
Okay. So there's a point, I suppose, that somebody has made that probably is quite relevant to your previous point, Sue. If we've done 35 hours of CPD in a year and then see a course later in that calendar year that would be useful, it wouldn't seem to be cost effective for my employer to pay for it if the hours can't be counted towards the current year's CPD. It's not really a question apart from how does she justify that with her employer, I suppose, but didn't know whether you had.
But to me, that would be disappointing, because if it's something that's a benefit to you and helps improve your professional abilities, then I would hope your employer would support you to do that. So, you know, this shouldn't be about box ticking. This shouldn't be about I've done 35 hours, stop. This is all about what you feel you need to do to improve yourself. And all of us will do more than 35 hours a year subconsciously, because we're constantly checking, reading, looking stuff up, and that is all a way of improving our ability to do our job. So I think you need to have a conversation with your employer and say, look, this is the benefits to me, this is the benefits to the practice. And of course, one of the things that perhaps we should say about, which was referred to with that bereavement course, you know, you go on a bereavement course, you do 35 hours of CPD, but it doesn't stop there, because you go back to the practice afterwards and you'll talk to the receptionists, you'll talk to the nurses, you'll talk to the other vets, you'll pass on your knowledge to them, you'll exchange ideas with them. So CPD that you do yourself, where you can benefit others from it, benefits the whole practice. It doesn't just benefit you. So I would suggest it's quite short-sighted of your employer not to allow you to do that, but then, you know, hopefully you can have that conversation with them and they'll allow you to do it.
Thank you. So the last few questions. As an editorial board member for a veterinary journal, can I count my review of submitted manuscripts as CPD?
Absolutely. Absolutely. Why not? Because you're reading, you're researching, you're commenting, you're reflecting. Absolutely. Yes, that's all CPD.
I've recently moved to a new company and I'm working through online training related to that company's procedures and software to fulfill my role. Does this count as CPD? Yes.
I don't see why it shouldn't, again, because you're training to fulfill your role. It's only the same as if you were training to do a certificate in orthopaedics. So yeah, absolutely. I do not see that shouldn't be CPD.
We've got two more questions. One is, I'm not sure if this is too specific to the circumstance. I'm doing OV training, equine exports, which says it counts for 4 hours of CPD. It took 30 last when I did it 3 years ago. Now all legislation and processes have changed. It will take me more than 4 hours. I'm not sure if there's any comment that's applicable to that.
I mean, I suppose that again, this is all about flexibility, isn't it? Because you'll see an article in a veterinary journal, it will say this counts as half an hour CPD if you read it. But if it takes you longer to read it, if you cross-reference it with other stuff, if you reflect on it, then it's considerably more than that. I think it depends on how long it takes you to do it and the reflection that's involved with it. So just because it says 4 hours doesn't mean to say it's 4 hours of CPD. So for me, that it would be, my opinion would be that CPD is as long as it takes you to do.
Thanks, Sue. So we've got two more questions. I manage a team of 30 vets and we carry out fortnightly meetings to discuss issues relating to our job. Can this count as CPD, and how should it be recorded in terms of topic name, as we don't just focus on one subject?
Absolutely, and that's really important, CPD, because again, I keep using this phrase, you're exchanging ideas, you're reflecting on stuff, you're learning from each other, you're sharing experiences. So that is absolutely right. As to what it would go under, I suppose that would be workplace based, would you say, Jenny? That would be case discussions around there. But again, you know, we shouldn't get too hung up about which category it comes under. It's the fact you're doing it, and I think that's some of the best CPD that you can do, because that's really excellent reflection and sharing each other's experiences. So yes, very definitely that should.
Yeah, I would agree with that, Sue. And using the app, you can record some voice notes as well about reflective discussions that you had.
And the final question, Sue, you might have some experience you could share. I do a lot of reading, but I never log it because I'm not sure how to do it properly to document my activity. What counts as evidence?
Do you want to Jenny, or shall I? I mean, what I would do is I would, as Richard suggested in the pre-recorded bit, I would just dictate after I've read the article. So go onto the app, go onto the dictation and say, I've just read a really great article on updates on treatment for whatever it happens to be. I think that, and reflect on it. So that's all you need to do. We're veterinary professionals, and I think a lot of this all boils down to trust and our professional responsibilities. So you don't have to prove you've done anything as long as you have recorded it and you've reflected on it. That is the important thing for me. I don't know. Would you want to add to that, Jenny, at all? Any comments?
No, perfect answer. So yeah, just remember to reflect. And we've done a webinar about reflection. So if you're not sure, you can go back to that.
Thank you very much. That's all the questions.
So can I just say before we finish, because obviously I'm a vet and everybody's terrified of college, but the guys in education, you've met Jenny now, are really, really approachable. So please, if anybody's struggling, anybody's not sure, email, pick up the phone. They're there. They really are there to help. So please make use of them. Me done. Over to you, Jenny.
No, just want to say thank you so much for taking the time. And if you have any questions, you can contact us at cpd@rcvs.org.uk. Thank you so much and have a nice afternoon.